Okay. Ah,
Other than color, so I'm just gonna jump there.
well, that's,
I just don't look too.
setting it right. Right.
That's why I was hoping for the connection. He was here one time.
Yeah, I guess you would have.
So I was sure.
No.
But I don't know. I don't know.
Yeah.
I wanted to be what she was.
Well, it's, right, I mean, it's popular. You know.
One of us seen her. Like I said, I really don't.
Never driven there. St. Paul.
We're good to go. There's a duplicate in there.
Yeah, so I don't think I've been to Wisconsin. I don't think I've stopped like
Yeah.
passing through. Other than that one.
Right over here.
She keeps saying it's beautiful.
You got it all over here.
Record kind of thing. Okay.
Everybody's got, so. So here's yours, or you can grab your trophy, doesn't matter. Oh, okay. Yeah.
So what have you got?
Yeah, you have to bring yours out like that. Yeah.
Take Becker's and put it up there. If you want.
Call this public health committee meeting to order. I believe we're live. The reason for this meeting obviously is to authorize Chairman Commissioner Hill to sign the grant application. With respect to State Department of Health. This is for funding of mass and vax outreach and for, I don't know about everybody, but I received one phone call
I have to see several.
opposing this, so. Laura, would you like to come up and give us the lowdown?
So this is a discussion that we started last Wednesday at Public Health Committee, and just to reset a little bit. The governor has made an announcement that up to $1 million is available for most counties to work closely with communities to create a landscape where the mask or vax protocol is understood and adhered to. Now, they called it enforcement. This county's response to calls and concerns that, and by the way, I received several over the last week myself, has been that three-step procedure that was adopted in 2020. Education is first, okay? And we talked last week about gentle signage, about putting masks in the hands of businesses. We also touched on the fact that it puts the businesses in a difficult position. And I acknowledge and understand that. The other thing we talked about is the community-wide fatigue that I think we're all experiencing, myself included, that early on in the pandemic response, we received a period of pause, a lot of shutdowns that affected this county and these communities a great deal. And it's really hard to talk in these masses. A great deal when we were seeing very little in community cases here at that time. So what do we have now? 231 active cases today. The health department did testing up at Highway this morning. 14 out of 41 were positive. We're seeing a lot of illness in the communities right now. I choose to wear a mask. I have been in public for a couple of months now. I make enough rounds in enough counties to know that different populations are responding to the advice to wear masks differently. So where we are now is the message from the governor's office last week was up to $1 million available, and it listed 4 activities that were potentially eligible for reimbursement. Janice had asked if there was any opportunity for upfront payment, and I've had a couple of pointed questions that I've asked to state health, and they say to with no response. So unfortunately, there are some things I still don't know. One, what is the term of this grant? And secondly, what exactly are considered eligible expenses? So at this juncture, you all had asked that I retreat and we retreat and make a plan for your consideration as you decide today whether or not Marion County will participate. So I did have an opportunity to talk with Scott at the Chamber. Certainly the Chamber of Commerce has relationships with businesses. And I would commend Scott and his team also for some really outstanding work on your weekly COVID updates and your general updates that go out to the businesses that help them get through a lot of information and call up the highlights, if you will. So we propose to work collaboratively with the Chamber. The health department, by the way, is already receiving emails and phone calls, complaints for and against, if you will. We're going to work with the Chamber to develop a system where the Chamber will respond to businesses who have had complaints made against them or concerns from customers, and follow up with them to promote the availability of masks, the KN95 masks that we received a good supply of, and also to provide them with some gently worded signage. And we talked about this business respectfully requests they be wear a mask to protect patrons, whatever. And that serious safety issues or persistent business complaints would be referred backwards to the health department, and that we would pick up the follow-up steps. And I want to remind everyone that the 3-step COVID procedure that's in place does not prescribe any amount of time between first, second, and third step. So we've got some latitude there. We talked internally about our lack of staffing. We could not be any busier between positive cases, testing, and vaccination clinics. Steve Perkins put his cape on and said that he would be willing to participate if the board chooses to do so, because he had been responsible for outreach and education and follow-up the last time we did this. Additionally, there's screening staff at the health system, assuring that people are masked when they enter the facility, and that just that medical screening piece, that may be an eligible expense. I don't know what the plans are for security in this facility with regard to the rotunda. That may be a potential expense. And beyond that, the health department took a look inward to see what support our organization could use. And we talked at least briefly about a COVID compliance coordinator, someone who would kind of track what was going on with regard to inbound phone calls and concerns. The other piece that we would be seeking for that position to do, if it's approved, depends on the timing, the length of this grant cycle, is assistive claiming in the health department. We've now got just 5 open active grants, and the dollars are, they're all very narrow in scope, but they all fit together, and we can do some additional support there. Any questions?
I have a question, the grant application, it's got various components to it. Can you pick and choose which ones you enter? So if all we wanted to do was education,
So last week, thank you for bringing that up. Last week, NYSEHO is the New York State Association of County Health Officials. It's our advocacy organization. Forwarded a statement from New York State that says that what we're doing currently counts as enforcement, right? That educational piece, the mask provision, the signage, the communicating with businesses. So I think where we are is there's kind of a split camp here. People who are in favor of taking whatever steps we can. There's a lot of COVID out there right now. The current variant is very transmissible, and we're seeing our case numbers are going up. So I think it's going to be a tough winter, but there's that split. I don't like to tell anybody what to do, except my kids. But I can say honestly that mask use right now is going to be a very important part of staying healthy this winter. It just is. In answer to your question, yes, we can choose.
or, so in essence, nothing is gonna change.
No.
From what we have been doing, and this is what we've been doing all along, it was in place before.
Right. But the landscape has shifted a little bit because Steve's now, retired from the health department. When there were a lot of occupancy issues associated, 50% capacity of, various businesses. That was how building codes ended up being at the table for complaint follow-up. Those, the occupancy issues are not, that's not relevant right now. It is mask use. So, and it is no different than what we've been doing. That procedure that the board adopted is still in place.
Questions, comment?
There's a lot of people that may say that it's a brag or whatnot, but we can use this money to educate what we've been doing. Using this rule of this, I think. So,
Great.
My understanding as well, y'all, is that this is not binding. This is an expression of interest. This steps in. So, it puts our interest on the table. And if at some point additional information becomes available that it changes the story, we're not under obligation. And Chairwoman Ryan, I think, is receiving a lot of emails from the state, with regard to what's going on. So, my impression is this is not binding, but in the same regard, I think mask use this winter is going to be really important.
Okay, so what's our pleasure? We want to move forward?
education is one thing. How about testing and vaccine? Technology.
So that's why we're seeking partnership with the chamber, truly, because as the demands in testing and vaccinations have gone up, we've had to redirect, to put our staff in places that are highest demand. So the outreach and education and the response, I think the chamber is well positioned to do so. The relationship is there with the businesses, and I have a great deal of confidence in Scott's ability to support our businesses and their employees and their families to stay safe this winter. That's really the goal.
I know, I think a lot of education is still lacking. For some people, there's a lot of misconceptions or, that's either being fed through the internet or just word of mouth. I know I try to, go online, which in itself, who knows how accurate that is, but, just comparing this to polio vaccine. And there's a lot of people who were saying, I don't want to take a vaccine because I don't know the long-term consequences are going to be. On children, on unborn children, on potentially having a child down the road. From what I've looked at in timelines, there's been more testing, a longer period of testing on this than there was on the polio vaccine when that was distributed. And that was initially targeting young children from the get-go. And all of the testing results and data gathering back then was done with pencil and paper, not huge databases and doing things like that. So I think some of the information on the health consequences related to receiving a vaccine needs to be put forth a little bit more, but I mean, I have very few businesses in my town, and we have one store, and I think if there's a vaccine or mask mandate that is enforced, that stores are closed, because they've lost so many employees already. The ones that are remaining are just gonna quit.
And that's not in anybody's best interest.
Right.
That's not the goal. And with regard to the misinformation and the fatigue, the period of response is now almost 2 years, which I can't believe. And the landscape has shifted dramatically. We went from, shut down locally with almost no cases, and then we had a vaccine that was, really prescribed who and how and when to get it. And then, now we're in a period where we're continuing to vaccinate. The number of people receiving initial dosage is low. Week over week, it's 30, 40, 50, something like that. We are doing a lot of boosting of eligible population of the people who are interested in doing so. And, the testing right now is absolutely key. So it's been a shifting landscape. You're absolutely correct.
So if we take this money, are we gonna start doing the more enforcing of the mask? Are we going out more with this complaints, or is that what this is about?
So it will, none of the finer points have been hashed out. So right now, the health department is receiving email complaints, lots of them. Phone calls are dropping into a voicemail box. I'm taking some. Dr. Collins, I think, has taken a couple. Rob, the environmental director, also taking some. I know Chairwoman Ryan has also. So it will result in those calls, concerns, being aggregated and followed up. If it was a concern regarding a particular store, then call that business and just say, look, we've got some patrons that are concerned about mask use. Can I provide you some masks to distribute at your site? Just to make sure people, soft touch is what I'm looking at. We haven't really dialogued our way through this all pretty late breaking. Welcome.
I know there's a lot of people who don't want to have the liberties taken away from them. I mean, I guess I look at it as just coming here today, I gave up certain liberties and stopping at the stop sign and driving on the right side of the road versus wherever I wanted to be. There are certain rules and I have to follow certain rules. And I also know there's a lot of individuals who are out there, whether for health reasons or whatever, they've been advised not to have a vaccine. I know a woman who was a transplant recipient. Physician told her not to have that because of the interaction with the drugs that she's on, and to say, all right, you are now held a hostage in your home for the past year. And regardless of taking care of yourself, that also means any of your family members coming in, you have to mask up to even see a family member coming in your own home. That's a tough way to live. And if we could just get more people to, I don't know, make the sacrifice and get through this winter, and hopefully get through the worst of this. I think it's more fair to them.
Dr. Collins, did you have anything to add?
Not a lot, other than that as Laura mentioned, the requirements from the state for this and how they're defining enforcement right now is extremely vague, but it's not prescriptive, and basically what we're already doing, essentially. They were very clear in saying that the education, passing out masks, signs, is considered enforcement. So unless they change that on us and insist that we move it to a higher level, if we have single complaints about a particular venue, that's kind of where we're at right now on this.
I think the ticket is education, more so than enforcement. I mean, if you're considering what Dr. Collins just said, enforcement, I mean, I don't see a big change here. So what was your plan with the money? Did you have like this is going in this pocket, this is going in that pocket kind of thing, or?
So we did not do a very deep dive, nor have we been asked to create any type of a budget to submit. Really what I provided last Wednesday is all we've gotten to date. So it really depends upon, the Public Health Committee's direction today on what we'll. So we, we'll take a look at this, and then, I presume sit down, Jess, Scott, maybe Janice and myself, and make a plan.
And Laura, I know everyone thinks that, well, not everyone, but a lot of the public, this is what I've heard, believes that there's going to be like $1 million dropped in our bank account. It's not even going to be enough. I mean, if we were to do this, it would not be enough. It was, whenever they say up to $1 million, it means for larger counties, so we're going to stay that.
So it's a max of 2 million in the largest counties, but again, without knowing, if we develop a plan, right? With the chamber, with the health department, with the health system, with this building, without the plan is developed, how much it costs depends on the term. Right now, the executive order regarding mask use expires January 15th. I fully believe it's going to be extended, but what is the term of this funding? I don't know the answer to that. Yeah, sure. There's a weekly phone call with the Finger Lakes Regional, the legislature's boards and health departments have a weekly phone call. It was earlier today, and many of them are having their organizational meetings and talking about this right now. So I don't get a sense what's regarding.
Any other discussion? Move forward. The motion, Brian?
Sure. No, I can't, everybody. Not,
Good try. Anyone?
I will.
Thank you, Supervisor Grant. I do have a motion from Supervisor Grant to move forward. We're not committing to doing this. So exploring, right?
That's correct.
So this is not a total commitment. So all in favor? Aye. Opposed? Carried. Is there anything for public health today?
Aye.
I guess he is.
It's Cheryl. Hey, Cheryl. Yeah.
A little.